Respiratory diseases, causes and prevention measures after floods and storms. After floods and storms, not only does the environment suffer, but people's health also faces numerous risks, particularly respiratory diseases. The changes in environmental conditions, high humidity, and poor air quality create favorable conditions for the growth of bacteria, mold, and allergens, leading to various respiratory diseases. Below is a detailed breakdown of common respiratory diseases, their causes, and effective prevention measures. 1. Causes of respiratory diseases after floods and storms. Following floods and storms, the environment becomes damp, and floodwater can pollute the air, providing the perfect conditions for pathogens to thrive. Key causes of respiratory diseases include a. Damp environment. After floods, humidity levels in the air increase, especially in areas with stagnant water. This is ideal for the growth of mold and bacteria, which are primary causes of respiratory illnesses like allergic rhinitis, asthma, and bronchitis. Example: living in a house that has been flooded can cause mold to grow on walls and furniture, leading to allergic reactions and bronchitis in people with weak respiratory systems. b. Air pollution. Floodwater often brings along waste, chemicals, and debris, polluting the air. Breathing in these contaminants can cause respiratory diseases such as sinusitis, pneumonia, and chronic obstructive pulmonary disease, COPD. Example: after floods, dust and fine particles in the air from flooded areas can cause symptoms like coughing, difficulty breathing, and pneumonia, particularly in the elderly and children. See exposure to chemicals and toxic gases. After floods, certain areas may experience the release of toxic gases from chemicals or oil spills, posing a respiratory risk if people are exposed without proper protection. Example: in some areas, methane gas from landfills or oil spills from vehicles can cause respiratory irritation or poisoning in residents. 2. Common respiratory diseases after floods. After floods and storms, respiratory diseases often become more prevalent due to polluted environments and adverse weather conditions. A. Bronchitis. This is an inflammation of the bronchial tubes, causing coughing, phlegm, and difficulty breathing. Bronchitis often occurs when people are exposed to polluted air or moldy environments. Example: elderly individuals living in flooded houses for prolonged periods are at higher risk of developing bronchitis due to exposure to damp air and mold. B. Sinusitis. Sinusitis is often triggered by inhaling humid and polluted air. Those with sinusitis experience symptoms like headaches, nasal congestion, and difficulty breathing. Example: people living in humid, polluted environments after floods are more likely to suffer from prolonged sinusitis due to allergies and respiratory inflammation. See asthma. Asthma is a chronic respiratory condition that easily flares up in environments with humidity and mold. People with asthma often experience episodes of difficulty breathing, dry cough, and chest tightness after exposure to polluted environments. Example: children and elderly individuals with asthma are likely to experience flare-ups when living in damp, unsanitary environments after floods. 3. Prevention measures for respiratory diseases after floods and storms. To protect your health and prevent respiratory diseases after floods and storms, the following measures should be taken. A. Maintain personal and environmental hygiene. Maintaining personal and environmental hygiene is key to preventing respiratory diseases. Clean and dry the house. After floods, clean and dry the house and furniture to prevent mold growth. Wash hands frequently. Regularly wash hands with soap and clean water to remove bacteria and viruses. Example: families in flooded areas should regularly dry walls, furniture, and avoid letting water stagnate in the house to prevent mold growth. B. Wear masks when exposed to polluted environments. When going outside or working in polluted environments, people should wear masks to protect their respiratory system from harmful agents. Example: after floods, while cleaning up, individuals should wear masks to avoid inhaling dust and pollutants that can cause sinusitis or pneumonia. C. Use air purification devices. In areas where conditions permit, using air purifiers will help improve indoor air quality, reducing the risk of respiratory diseases. Example: Some households can equip air purifiers to remove mold, bacteria, and fine dust particles, helping to reduce sinusitis and asthma symptoms. D. Boost immunity. Maintaining a proper diet, supplementing with vitamin C and regularly exercising can help strengthen the immune system and prevent respiratory diseases. Example: drinking plenty of water, eating fresh fruits rich in vitamin C, and maintaining daily exercise habits can strengthen the immune system, helping fight off disease-causing agents. 4. Treating respiratory diseases after floods. If you experience symptoms of respiratory diseases, seek assistance from healthcare facilities for timely treatment. A. Take medication as prescribed by a doctor. If experiencing symptoms of bronchitis, sinusitis, or asthma, patients should be examined and take medications as prescribed by a doctor. Example: patients with pneumonia need to follow the prescribed antibiotic regimen to avoid dangerous complications. B. At-home treatments with supportive measures. In addition to medication, patients should rest adequately, drink plenty of water, and keep warm to aid recovery. Example: sinusitis sufferers can use steam therapy or saline nasal sprays to clear nasal passages and reduce congestion. Conclusion: respiratory diseases pose significant health threats after floods and storms due to polluted environments and adverse weather conditions. By taking preventive measures such as maintaining personal hygiene, protecting the respiratory system, and boosting immunity, we can minimize the risk of developing diseases. Timely treatment when symptoms arise is also essential to prevent serious complications.